My name is Jenna Angelillo, and I am here with Dr. Joe Nguyen. Dr. Nguyen is the partner physician from Mission Heritage Medical Group in Mission Viejo, California. Welcome.
Morning. Thank you. Yeah.
Um, Dr. Nguyen, I was hoping you could talk to us a little bit about how you got your Concierge Choice program started and how you decided which physicians to participate in the Concierge Choice program.
Sure, absolutely. So having done medicine for 20 years, a few of my partners and myself who've done medicine for longer than 15 years came to the sense that we wanted a higher level of care that we can perhaps provide for our patients. In the same way, allow us to be more fulfilled by practicing that old style of medicine where patients were very intimately known to us and had access to us, and we would have access to them 24/7, as well as even making home visits. So very kind of retro Marcus Welby style type medicine was in our idea. And so as such, really 4 years ago was when we were introduced to Concierge Choice. And as such, it's been a very arduous process to allow a health system to vet this process to make sure that as part of our hybridized usage of concierge and our attention to our general practice, that there would be an even attention to both groups of patients. So as such, I think the selection for a physician who's interested in concierge choice is one that's just innately interested in their patients and just really wants to be as 100% invested as they can without these artificial barriers of what modern medicine has become. So I think that's really the origin of what would want to make you, as a concierge physician, seek out a program like yourself and provide that level of service for patients.
Okay. And so when you began the Concierge Choice program at Mission Heritage Medical Group, you started with a select number of physicians, just 6. And can you tell us a little bit about how that went and, how you kind of moved into subsequent waves?
Sure. So I think that starts with having a realistic assessment of, do you have a volume-based patient load that would account for a certain percentage of that clientele to want to become concierge patients themselves. So I think it was realistically looking at your practice volume and realistically looking at your sense of how much of a relationship do your patients prize in advice that you have to give, the trustworthiness of the sort of healthcare you've given them through the years, and just doing that honest inventory to say, would a patient want to, sort of separate themselves with a certain fee in terms of the checkbook amount to really have that higher level of entrusted service by you. So, and that involved concierge coming in and doing a survey to really say, well, doctor, how well do you know yourself? How well do you know your patients? And as always, reality will come to fruition as far as, do you have a certain percentage of patients that will seek to do this? And for most of us, the realization is we really just needed a number of somewhere like 10, maybe up to 20%, depending on what our health system allowed us to do as part of a concierge limit of patients in the end anyways.
So now you've added, after your first wave, you've added subsequent waves. You have now a few new doctors from Mission who are adding programs. Did they see your initial wave of doctors and they saw the success and decided that they wanted to do it themselves, or was this something that you selected them for the program?
Yeah, we're really proud to say, Gianna, that for us, the original 6, we're really looked at as a pilot. And so as such, our success would be looked at as something to want to emulate. Our failure was to be looked at as, we're not going to want to do that. And so as such, within that pilot timeframe, we're really all proud to say it really went well. It went well in the sense of 2 things. Number one, we kept our promise to make sure we kept our attention on general practice, which made the health systems comfortable that there was no patients being abandoned. That's point number one. Point number 2, as concierge goes, it really is a matter of your life is not in prison, which is what a lot of the outsider doctors tend to think, which is, oh my goodness, so you sign up this patient, you're responsible for them 24/7. Are you not going to just live and die by their existence? The answer is absolutely not. And so patients are very respectful. They're respectful that in our current times, we all understand the value of time. Time cannot be, sort of redeemed. It can't be repurchased. So everybody understands the value of time. And so as such, the patients are very respectful in accessing you when they really feel there's a need for that time. And we're happy to fulfill that importance of what that time means to them, which is a answer for something super important, after hours. Meeting a health issue for a patient I contacted this morning who's in Green Bay, haven't seen a Green Bay Packer football game, said, Dr. Joe, I woke up this morning with a discharged my eye. Do you think you can spare me going to urgent care? Can we do a quick FaceTime and can you send something into a Walgreens in Madison, Wisconsin? I said, absolutely. So that again, time fulfillment of a wonderful service that really kind of saves them inconvenience, worry, the unknown is really invaluable. And so a lot of the outside doctors have seen how much we've all enjoyed that opportunity to fulfill that gap that doesn't exist in general medicine. And thus, I think it was an easy sense to market that to other doctors, really just by what they saw and how much we enjoyed it and how it did not imprison us or overwhelm us.
That's great. Well, thank you so much for telling us a little bit about that.
Yeah, you're welcome. All right. Thank
We
you.
look forward to working with more Mission doctors.
Thank you so much.
Have a great day.
Thank you.